Go.
All right. So we're going to do a long lever manipulation to the ankle joint. We've ruled out any knee dysfunction or hip or lower back dysfunction. You wouldn't do this technique if they're suffering from acute lower back or there's knee issues. Now, the big mistake that people make is when they're doing ankle technique, they're too straight onto the couch and they're ending up having to use their arms to do the manipulation. Whereas if they split the stance and drop their body weight down, they're immediately able to lean back, which almost engages that traction to start with. So you're almost hitting the manipulation halfway already without having to even put the force through it. So what I get the patients to do is get to 40 feet down and then all the way up to the top for me. And I'm just looking for quality and quantity of movement, see if there's any obvious sort of dysfunction between the two. So I'm going to manipulate the right ankle. So what I'm going to do, I'm going to hold on to the calcaneum to start with. Lock on nice and tight. With my other hand, I'm going to use my thumb just to add some slight dorsiflexion, and I'm going to web over the top in that position. Now, I'm going to slightly internally rotate, so I'm going to lock out the hip, and I'm going to drop my body weight down, so I've got a lower centre of gravity that's going to allow me to lean back, so add the traction, and then the thrust is going to be towards me. Alright? So internally rotate, take hold of the calcaneum, drop my body weight down, take a deep breath, and nice relaxed breath. Straight through. Back up for me. Once I've done that, I'm going to look up onto the fibula head. Again, I'll bring the knee up, find the fibula head. With the first MCP, I'm going to lock behind and bring my elbow round. So I'm almost bringing the fibula head round of itself. Hold the ankle above the medial lateral malleoli so it's nice and stable. Come side on. Lock round. Take a deep breath. As he breathes out, a little short. And that went quite nicely.